Hello everyone, my name is Jordan Fomby and I'm a student physical therapist assistant at Jeff State, and today I'm going to be talking to you about torticollis. Torticollis is a condition in which the muscles of the neck are contracting, pulling the head into a side bending or twisting motion. This disease actually does not have an exact cause, but some things that can influence this disorder is if the neck muscles have been recently affected by some sort of trauma or some previous condition. Muscle spasms, problems within the nervous system, and even problems of the upper spine can also cause this. Some signs and symptoms vary. Some can be more physical than the others, so some of the non-physical ones can be headaches, limited range of motion, neck pain, swelling and stiffness of the neck muscles. Some more physical signs would be head tremors, a shoulder being higher than the other, or just awkward positioning of the chin. This can vary depending on the severity of the case, so each case might look different. This is usually diagnosed with a physical exam or blood work. And the reason blood work is because it can run in the family. Some other tests that would be done are CT scans, MRIs, x-rays of the neck, and this also helps to determine the severity of the case. The treatments with this disorder really does vary on the age, the extent of the severity, and how the patient can tolerate or handle the pain. So, for example, some treatment options would be surgery, wearing a neck collar, and physical therapy is one of the main ones because this can branch off into heat therapy, traction therapy, and just stretching for physical therapy. There are medications that can be taken with this to help within the muscle spasms. So some of them is baclofen. That's a pill form that you can take. There's an injection form called botulinum. So it gets injected into the side of the muscles within the neck, and that helps with the muscle spasms. Or ibuprofen can also be taken, and this is to help with the severity of the pain and inflammation. So some surgeries that apply to this mostly are seen in infants and children. Now, it can also be seen if there is excessive scarring of the sternocleidomastoid muscle, because this one is really hard to loosen up once it's severely scarred. So surgery consists of making an incision into the neck to release the contraction of the muscle. This is not a very invasive surgery because people usually get to go home the same day that it's happened. Now, this is the last resort, so we would want to try different things before actually going towards surgery because there's actually a very good prognosis for this. Physical therapy helps a lot, but if someone had an acute torticollis condition, they would usually, with physical therapy, be back to their normal self without 3 weeks if they did their stretching and exercises right. Now, it can be different with someone with chronic because once your neck is stuck in a position for so long, this can start causing neck deformity and where it would be hard to straighten it back out and get full range of motion within that muscle. So, physical therapy, you usually use a stretching for this. Now, in other cases, they could use heat therapy or traction, but we're just going to use stretching today. Stretching has an impact on this disorder because it produces more range of motion within the sternocleidomastoid or any of the neck muscles that could be affecting this. It also helps with pain and helps put the head back into the right position so people can have better range of motion within their daily livings. So with this disease and disorder, because it could be a disease because it's passed down their family in some cases, but this has a good prognosis if treated correctly and in early cases. So physical therapy, another thing with stretching, that also gives it something you can take home with you in case the symptoms start occurring again. You can get it checked out and fixed, but you would need to seek a medical doctor just to make sure the occurrence is not coming on again of this disorder. Thank you for listening. That's all I really have about torticollis. If you have any questions, just comment below. Thank you.